What do you think of single payer? And first, explain it as you understand it. I think that's critical because most people don't even understand the idea of government paid for health care. And compare it to a public plan. And then where do you see us going now, and where do you think we have to go?
Yeah, I think one of the ways for people to understand how a single payer system works is to look at our Medicare program, which is a single payer program. The government runs the program, so we have a very popular government-run program in this country and have since the 1960s, and it has made enormous difference in the lives of people who are elderly and disabled. In fact, the satisfaction ratings of people who are enrolled in Medicare, and these are people who are elderly and disabled who have a much greater chance of needing care than people who are younger and who are enrolled in private plans. The satisfaction ratings of people in Medicare is higher than it is for people who are in private plans. In Canada, their system there is called Medicare, and it is a system that essentially has taken our Medicare program and expanded it to include or be available to all their citizens. And in Canada, it's probably the ultimate single-payer system. There are no private insurance companies that compete for business. In the UK and some other countries in Europe, there are government-run programs, but some allow insurance companies to operate. So there are different kinds of government-run programs, or programs that are essentially financed largely by the government. But even in a single-payer system like in Canada and our own Medicare system, the care is delivered by the private sector, by doctors and nurses who are in private practice and by private hospitals. So it is not a government takeover as some of the industry and its allies would like us to believe. It is not a government takeover of the healthcare system by any means. In a single-payer system, doctors and nurses and hospitals deliver the care. And people have a broad choice. They're not restricted to certain doctors and nurses and hospitals.
Are you for single-payer health care in this country?
It works in Canada. There are people in Canada, I think the satisfaction ratings in Canada, people are much happier with their system there than Americans are here. In fact, more people in this country are uninsured than the entire population of Canada. And if you take into consideration the number of people who are underinsured now, and that is a number that is growing because of the new health plans that are being sold, these so-called consumer-directed plans that are really high-deductible plans. When you add those people in, there are more people who are either uninsured or underinsured than the entire population of the United Kingdom. So, we are at a point where some fundamental reform is absolutely necessary. We can't let another opportunity go. We can't go another 15 years before we have some meaningful reform.
Should there be for-profit health insurance companies in this country?
Interesting. One of the big champions of the so-called consumer-directed plans is a woman named Regina Herzlinger. She's a professor at Harvard and is kind of considered the guru of consumer-directed plans. She often talks about the Swiss system as something that the U.S. might look at as a model, because they presumably have something like a consumer-directed care there. They do have private insurance companies that operate there. The interesting thing is that she doesn't mention too much, or at all for that matter, is that while there are insurance companies that operate there, for-profit insurance companies are illegal in Switzerland, and they are very highly regulated. They all have to offer standard benefit plans, and so there's nothing like the kind of system that we have here. I think in many ways it might not be a bad model to look at, because there are no for-profit companies that operate there. Some of the companies, even in this country, do sell supplemental products in Asia and Europe. But I kind of think the Swiss are onto something. If they don't allow for-profit insurance companies to operate, there must be some good reasons why they think that should be the way it is.
Wendell Potter, as you look back on your life and look forward about what your plans are now, you voluntarily left as the chief of corporate communications at CIGNA. Would you do things any differently?
You know, I've said that the 20 years I've spent in the health insurance industry, looking back at it now, I feel like I was a journalist undercover for 20 years, and that helps me sleep at night to look at it that way. Yeah, I think there's some things I would do differently, but on the other hand, if I hadn't done what I did, I wouldn't know what I know now, and I wouldn't be in a position to be able to speak out and to disclose and describe what really goes on. So, you know, you can't really look back and say, I wish I'd done this, because it doesn't do a bit of good. I think you just have to do what you can do in the present moment, and hopefully that it'll make a positive difference. And that's what I hope to do going forward.
And finally, as the push for health care reform continues, it looks like President Obama is having a mutiny within his own party. What they call the conservative Democrats, or the blue dog Democrats, look like they might even be backing away from a public plan. In fact, Rahm Emanuel, President Obama himself, seems to have backed off somewhat, saying that may not be the first step in health care reform. Does this concern you? And what advice would you give to them right now, when you have a population that's overwhelmingly for a public plan, if not single payer, and filibuster-proof Democratic majority in the Senate?
I think it would be absolutely disastrous for the administration to even consider signing legislation that doesn't include a strong public plan. You're exactly right. And I think many, many people voted for Barack Obama because of his health care platform and the things that he said he felt were vital in terms of reform. The inclusion of a public insurance plan is paramount. It is absolutely necessary, and I would hope that people who voted for him and people who are uninsured, who are underinsured, will make sure that he understands that. I think what Rahm Emanuel said, let's hope it was a trial balloon to see just what kind of reaction it might get. And I think it was swift. People who are supporters of the president, from what I understand, were very, very quick to say, you know, that dog won't hunt. You got a public plan is important. It is something that we expect, and we expect that you will get behind it in a strong way. I think the president's influence may be seen more toward the end of this process. There will be a House bill that's hopefully passed, a Senate bill that will be passed, that will be different, because they always are. And there will be a conference committee that will need to be held to iron out the differences. And I think that will be a time when the president's influence will be especially needed to make sure that a public plan, and a strong one, is included in the final legislation that reaches his desk.
Wendell Potter, the former chief spokesperson at CIGNA, one of the nation's largest for-profit health insurance companies. Friday on Democracy Now!, Howard Dean will be our guest as we continue to look at health care in America. His new book is called Howard Dean's Prescription for Real Health Care. If you have suggestions for questions for Howard Dean, you can email us at stories@democracynow.org, or for any other stories, or if you're a whistleblower, well, let us know. If you'd like a copy of today's show, you can go to our website at democracynow.org. You can also follow us there on Twitter. Today's Hour expose with Wendell Potter, the former spokesperson for CIGNA, now a whistleblower, is on our website, video and audio form. The full transcript, you can send it around, email it everywhere, Twitter it to whoever you want. Democracy Now! Is produced by Mike Burke, Sharif Abdel-Qadoos, Aaron Mate, Angelique Hammett, Steve Martinez, Nicole Salazar, Hani Massoud, Robbie Karen, Mike DeFilippo, Miguel Noguera, Peter Curry's our engineer. Special thanks also to Becca Staley, Nick Gillick, Hugh Grant, Samantha Chambly, Jessel Noor. I'm Amy Goodman. Thanks so much for joining us.